Glad to have you back here on Gist Nigeria, brought to you by the BBC and Channels TV. I am Wali Fakile. Thanks a lot for staying here. Coming up in a bit, the woman supporting NGOs to empower young women. But first, the World Health Organization has recommended more testing to contain the spread of the coronavirus. With test kits in short supply globally, countries like Ghana are adopting a different approach to maximize use. Scientists are conducting pool testing, where they are able to test multiple samples simultaneously. But how accurate are the test results? The BBC's Thomas Nadi reports for Gist Nigeria.
Here at the Noguchi Advanced Laboratories, scientists are busy at work. They are testing samples of potential cases of COVID-19. It's one of the 9 testing centers in the country for the virus. As health authorities intensify contact tracing of all persons who might have been exposed to the virus, the laboratories are now overwhelmed with samples. To be able to respond as quickly as possible, despite low test kit availability, the scientists are adopting an innovative approach. These 10 samples have been put in this test tube and mixed with chemicals and is ready for testing. If it tests negative, what it means is that they are free from the virus. If it is positive, then the individual samples will have to be tested to identify the infected one. Scientists here believe that this is an efficient method to identify the virus. But how accurate is pool testing as it is known?
Before you start, you determine the level of detection, the limit of detection. So you know how sensitive your method is. So you would be 100% sure that the sample that you have determined as negative is negative, and the sample that you have determined to be positive is positive. It's as sensitive as testing the sample alone.
Ghana has ramped up testing with this process, and over 100,000 samples have been tested so far, one of the highest in Africa. The country's infection rate of the virus is 2%. But the pool testing, as it is known, is only efficient while Ghana's infection rates remain low.
The limitations come in when you start getting the majority of your wells being positive, in which case you have to rerun the majority of the pooled samples again. And then you lose the benefit of the efficiency of doing them concurrently that you otherwise would have if the test positivity rate was low.
Ghana's medical drones are also now being deployed to deliver samples to labs. This is to enable authorities identify and isolate infected persons quickly and contain the spread of the virus. And for those who need treatment, the Ga East District Hospital is one of the main centers they are taking to. In this treatment center, they are both young and old patients. This virus doesn't discriminate. And doctors here tell me that more patients have been brought in because the country has increased testing for the virus. This hospital is the front line of the fight against COVID-19 in this country. The hospital has received over 200 patients, and more than 100 have recovered and have been sent home. It's early days, but Ghanaian scientists are already gaining a better understanding of the virus and are now working on developing a vaccine to fight the disease.